Hello, my name is Ivy. I'm a fourth-year social work student at Toronto Metropolitan University. I'm currently completing my placement with the Organization for a Safer Space. Today, I'll be talking about obsessive-compulsive disorder. In this video, we'll first look at what obsessive-compulsive disorder is. We'll then look at some statistics, risk factors and causes, symptoms, effects, treatment, and lastly, we'll look at some coping strategies. Obsessive-compulsive disorder is a type of anxiety disorder. It is a chronic disorder that consists of repeated obsessions and compulsions. Obsessions are unwarranted, recurring, and distressing thoughts, impulses, ideas, or images that a person cannot control. Compulsions are behaviors, rituals, or routines that are repeatedly done to help relieve the anxiety caused by obsessions. Obsessions and compulsions can be experienced by anyone. For example, it is common to double-check if the stove is off before leaving home. Worrying that you will forget to turn off the stove is the obsession, and repeatedly checking the stove is the compulsion. However, obsessive-compulsive disorder can be out of control and hinder one's daily life. Statistics. Approximately 1% to 2% of people have obsessive-compulsive disorder or will have this disorder in their lives. The age of onset for 65% of people with this disorder is 25, while 15% of people will have obsessive-compulsive disorder after the age of 35. 81% of people with obsessive-compulsive disorder have more than one type of obsession or compulsion. Risk factors and causes. Obsessive-compulsive disorder is believed to be caused by a combination of psychological, biological, genetic, and environmental factors. The risk factors can include low serotonin levels, which is a substance in the brain that helps to regulate mood, impulse control, and sleep. Overactivity in parts of the brain involved in the control of feelings and actions. Genetics. Significant life changes, abuse, death of a loved one, trauma, illness, which can start an obsession with germs and excessive washing, school or work issues, and relationship issues. Symptoms. The primary symptoms of obsessive-compulsive disorder are the recurring obsessions or compulsions that affects a person's daily life. The symptoms are time-consuming or lead to excessive clinical distress or impairments in a person's social, occupational, or other areas of life. There are different kinds of obsessions, including contamination obsessions, perfectionism, violent obsessions, religious obsessions, and sexual obsessions. Contamination obsessions can include a fear of germs, dirt, body fluids, diseases, environmental contaminants, or household chemicals. Perfectionism involves an obsession with exactness, worrying about making mistakes, worrying about forgetting significant information, and excessive concern about undertaking a task correctly. Violent obsessions include a fear of harming oneself or others. Religious obsessions can include extreme concern about having blasphemous thoughts and offending God. Sexual obsessions can involve forbidden sexual thoughts or images. There are also different kinds of compulsions to suppress obsessions, including checking, ordering or arranging, cleaning or washing, counting or touching, hoarding, and mental rituals. Checking can involve checking the door or locks to ensure that everything is safe, or checking paperwork for mistakes. Ordering or arranging can involve arranging objects in certain ways. Cleaning or washing can include excessive hand washing, showering rituals, toothbrushing rituals, and excessive cleaning of objects. Counting or touching can include counting or touching objects in a particular way or a certain amount of times. Hoarding includes collecting useless items such as newspapers. Mental rituals includes praying to avoid harm, counting when performing a task, or replacing a bad thought or image with a good one. Obsessive-compulsive disorder can also have emotional and physical symptoms. The emotional symptoms can include anxiety, worry or fear, sadness, anger, guilt, and shame. Meanwhile, the physical symptoms can include a racing heart, dizziness, headaches, stomach aches, muscle tension, difficulty breathing, and feeling detached from the body. Effects. If left untreated, obsessive-compulsive disorder can lead to the following: a decrease in school or work attendance or performance, social isolation, weakened interpersonal relationships, financial issues, lower life quality, substance abuse, and suicidal ideation and behaviors. Treatment. Studies have found that 76% of people who have completed their treatment, or 13 to 20 sessions, have significantly reduced their symptoms of obsessive-compulsive disorder. A type of treatment for obsessive-compulsive disorder is cognitive behavioral therapy. With this therapy, one can identify their obsessions and compulsions, learn methods to challenge one's thoughts and habits, and develop new and healthier ways to cope. Another type of therapy is exposure and responsive prevention. This therapy involves a person performing a task that causes anxiety. The healthcare provider helps the person from reacting with their compulsion. A healthcare provider may also prescribe medication, including antidepressants, anti-anxiety medication, or antipsychotic medication to reduce symptoms. Coping strategies. There are various helpful coping strategies to deal with obsessive-compulsive disorder, such as breathing techniques, meditation and mindfulness techniques, having a self-care routine, which can involve getting adequate sleep, eating healthy, and exercising regularly, and reaching out to loved ones who can help, as they can provide emotional support and consequently improve one's well-being. If you have any of the symptoms described in this video, it is important to seek help. Feel free to check out the Organization for a Safer Space at forasaferspace.org, where you can have access to accessible, affordable, and affirming mental health care with licensed mental health professionals. Thank you for watching and have a great day.